Hi, Mike Gibson, Kevin Alexander coming to you live from HA 2025, and we're talking about Acoramidis and mortality among different genetic variants. Kevin, talk to us a little bit about what you found.
Yeah, thanks for having me, Mike. So, as you recall, the ATTRibute-CM study was the pivotal phase 3 clinical trial comparing acoramidis to placebo in patients with ATTR cardiomyopathy and showed a significant benefit in a composite, including all-cause mortality, cardiovascular hospitalizations. We further looked at subsets of ATTR-CM, specifically the variant ATTR-CM population. These individuals tend to have a more progressive and aggressive disease and worse outcomes compared to wild type. And so we wanted to look at the effect of acoramidis in this important subgroup. What we found is looking at a composite all-cause mortality and first cardiovascular hospitalization, that there was a relative risk reduction of 59% in the overall variant population. And then we also looked specifically at the V122I variant, which is the most common variant in the US and also disproportionately affects African Americans. And in this important subgroup, 69, there's a 69% relative risk reduction in that endpoint.
That was the composite endpoint, but what about mortality, Kevin?
So, importantly, we also saw that there was a 69% relative reduction for all-cause mortality.
So when you look at this statistically, is there an interaction term by variant in the benefits in the study?
That's a good question. The numbers are relatively small, so I would say that this is a hypothesis generating findings, and that we need more data to explore further.
Yeah, I mean, interaction terms are notoriously underpowered. So then when you get into small numbers of patients, even though the differences look pretty profound, they can be underpowered to detect a difference there. Well, Kevin, congratulations. Thanks for expanding our understanding of the genetics of this. Thanks to all of you for joining us here live from HA 2025.